Okay, welcome everyone this afternoon. Today is Sunday, the 22nd of November 2020. And as we all know, is a couple of weeks to the Christmas. And Nigeria, as it is today, is being still um, ravaged with COVID-19. And many of us don't necessarily know what is happening with COVID-19 within the Southeast. Some of us understand that there is COVID-19 in Nigeria. We have seen people complain that they fly there, their destination is the Southeast, yet they cannot find a place to test for COVID-19 in the Southeast. They have to go back to either Lagos or Abuja in order to do their tests, which they've paid for in advance. Now, to throw more light on what is happening with COVID-19 as it is today in the southeastern part of Nigeria, we have arranged this conversation this afternoon titled COVID-19 Testing in the Southeast Nigeria, Access to these testings, Challenges and Prospects. Now, to have a deeper understanding of these topic today, I have Dr. Emmanuel Nna, who is the MD CEO, Safety Molecular Pathology Laboratory, Enugu. Now, he has been in this field for so many years. And the initial time I had a conversation with him, I was blown away to the things they do in the Southeast that no one appears to know about. Now, to have this conversation and have a deeper understanding of what is happening within the Southeast Nigeria as regards to COVID testing and COVID itself, we will have the privilege to invite Dr. Emmanuel Nna. Doctor, you're welcome to this program this afternoon.
Yeah, thank you, Mazi Ezoke. It's a pleasure being with you in the program, and I'm happy for you inviting me as well. And to our audience, good afternoon and evening, wherever you are.
Okay, thank you. Thank you very much, Doctor. And to kickstart this, Doctor, it might be helpful for the viewers to, as the old saying goes, to hear from the horse's mouth. Who is Emmanuel Nna? Who is Doctor again? That's people say Emmanuel Okechukwu. Can we meet you? Who are you?
Thank you. Emmanuel Okechukwu is an Igbo man from Ndoki in Abia State. I grew up in Abia State. I had my early education at the University of Nigeria in Nsukka, and worked there for some years, about 4 years, before traveling overseas. I then studied in United Kingdom, MScs and PhDs and so on. And I live in the UK, but I'm the MD of Safety Molecular Pathology Lab. My background is in molecular genetics, which specializes in using DNA for studying diseases, for diagnosing diseases, and for monitoring them, classifying them, and so on. I've been in the field of molecular genetics for the last 20 years, but I've been in the field of science over more than that, right from University of Nigeria. So I won't Igbo, but I think this audience is, people may not all hear Igbo, so, but I have to still greet our people in their language. So ndi Igbo ekele munu, bo onye ọbụla nọ ya gaziere ya ọfụma.
Thank you.
Thank you, dear.
Thank you very much, Dr. Emmanuel Nna there. You said you studied molecular genetics.
Yes.
And it's a field you've been in the last 20 years. Wow, that's quite it. So how do you manage to have, you say you live in the UK, and how do you run the My understanding, the molecular lab in Enugu, that's where your office, that's where the lab is in Nigeria, right?
Yes. So so to give you a background quickly, the Safety Molecular Lab started in 2009. And it started while I was in Imperial College. I was working there as a scientist. So we got samples from Nigeria who are leukemic patients. They have kind of leukemia called chronic myeloid leukemia. And my boss, who was he's an Italian, walked in that morning. We are very, very close, very friendly. And she made a joke. She said, "We have these 3 samples from Nigeria, and the patients came physically to do this test. That we'll be able to get them results, but you see the problem with the Nigerians, they may not go back." So yes, we cracked the joke, but something in me started asking, why did someone have to travel from Nigeria to UK to do a test that a fellow Nigerian is in charge of that testing in the UK? So I went through the lab. I know if you're in the UK and you've been to Hammersmith, you'll be to the MRC building, the very tall building. So we're on the 5th floor then. So I thought of it, so, going back that day thinking, what exactly is making it difficult for somebody in Nigeria to have that test? Is it the instrument or the manpower? And so I thought about this, and then I said, okay, I need to visit the country back and think about how can we make it that every leukemia patient can have this test done in Nigeria. So to give you an idea, to run that test in the UK will cost the patient £180. So as of 2010, we started doing that test in Enugu at the cost of 6,500 naira.
Jesus.
Now, because pricing of a test hinges on several factors, the level of insurance you pay, the cost of living, and so on. Now, this test, known as BCR-ABL test, is what defines how a chronic myeloid leukemia patient will be treated, the drug you will take, the monitoring, and so on. So at that point, 2 things happened coincidentally. One was us coming to do the test in Nigeria, but also the drug company called Novartis was on the verge of giving the drug, which costs on average 500,000 per month to the cancer patient. Novartis was planning to give this drug free for a cohort of CML patients in Nigeria, since they could not afford it. But the question is, for you to climb onto using this drug, they need to know that you're BCR-ABL positive, so you have to be tested. This is what we call molecularly targeted therapy. In other words, you are put on a treatment based on a certain molecule that defines that disease. And these 2 things came together. We came into Nigeria in 2019, and Novartis was planning to do this as well. So initially, wanting to put the lab in Abuja, but through an event that brought me to Professor Fomokoye in course of my flight to Nigeria, I found out that we could have a space in the University of Nigeria, Enugu campus, which is where I studied myself, to put this lab. And we quickly started the lab, focusing then for the diagnosis of the CML patient. And I must tell you what a testimony one of the patients from Lagos told me about 3 years ago. The patient told me that one Alhaji said, when he came to London for his checkup, and he went to Royal Marsden, that every Nigerian he met in Royal Marsden who came for checkup had a result from Safety Molecular Lab on the BCR-ABL. In other words, to date, no CML patient in Nigeria who has not been tested in our facility. Both the test for you to be placed on treatment and the test for to know when you are no longer responding. So now, in over these 10 years, we've served that community, and that expanded our testing to so many other areas. So I'll just give you a background of what led to that. But back to your question, how do we coordinate that? The lab was built on a strong technology platform, very strong technology platform in real time. The laboratory management information system, the instruments, the softwares, they are all web-based, well-linked, with real-time working between UK and Nigeria. Yes, there is a physical visiting frequently, but the way the system is configured, both instrument, physical activities are in real time linked together. So it's almost like people working in the same place, but not seeing themselves physically. Then the lab, of course, grew up. By 2014, we moved to Rangers Avenue. Those of us who know Rangers Football Club, that street is named after them. And in fact, where we are now, the Rangers used to be around there in the past many years. And since then, we've been operating in Enugu, the Safety Molecular Pathology Lab, up until last 2 years when we added an institute, which is now known as the Molecular Pathology Institute. So in terms of how a lab works, the contact with staff training, manpower, testing, and all the rest of them, both systems are linked up properly in real time. You will know what is happening in the lab in real time. We've really used this technology for years and it has worked. You can see what Zoom is doing now, but bear in mind that companies have been using that many 2-3 years. Skype, TeamViewer, AnyDex, all these technologies have been there for companies.
So let me make a clarification here. You said while you were talking, you mentioned that samples come from Lagos to Enugu to your lab, right? Is that correct?
Yes. So not just Lagos. So for the first time in medical practice, you could have samples come from Maiduguri, Sokoto, Lagos, Ibadan, all nook and cranny of the country to the east, to Enugu. That was what Safety Molecular Lab brought. It was the first time that a physician in Sokoto says, where do I test for BCRF? He said, oh, you have to send it to Enugu. The physician in Ibadan says, where do I test for BCRF? He said, you have to send it to Enugu. The person in Calabar says, where do I test for this? He said, oh, go to Enugu. Kano. We got all states in the country, their samples coming down to Enugu for this particular test. And of course, the next test that followed it, which we call the tyrosine kinase domain mutation. And we've done this for the last 10 years successfully. And that led us in the last 4 years to start putting sort of branches closer to these clients to help in the logistics, timely delivery of their samples with no stress to them from our local branches nearer to them down to the testing hub, which is the lab in Enugu.
Okay, so now let's take, for instance, if a patient in Lagos wants to have a test done, do you have an office in Lagos? Or
yes, we have an office in Lagos, which is at number 11 Ogundana Street, Allen Avenue. Number 11 Ogundana Street, Allen Avenue, Ikeja. So we have Safety Molecular Pathology Lab there. So it provides these services for like lawsuit, loot. Their patient come in there, they are sampled, and this sample is quickly packaged properly. Some will need pre-processed, and the next day they are in Enugu. Overnight they are in Enugu.
So they're flying with flights, or how do you see them?
If it's very urgent samples, yeah, they use the flight. If not, they go by usually night buses in Lagos overnight. So sample that are packaged in the medical box by 5 p.m. By 8 a.m. in the morning on the next day, you have it in Enugu. And usually the turnaround time for this particular test is 4 days. So within that time frame, Enugu had finished testing. Now the company works on a web-based LIM system, so which the person in Lagos could access online. Any other branch, some clients could access in their own portal.
Wow, it is indeed something very gratifying, because I mean, for the first time, because of your involvement, you've been able to change a tide that suddenly, people from all over the place will go back to the Southeast in order to have this test done, right?
Yes, and we are very pleased. But more to that is that unless somebody is traveling overseas for a personal reason, there is no longer a story that a leukemia patient cannot be attended in Nigeria, unless you are going overseas as part of another trip, not because I'm a leukemia. This is a leukemia patient. There's no access to diagnosis. No, that has stopped.
Yeah,
so
but
two things happened. One, of course, the patient does this test in Nigeria. He doesn't need to travel overseas, so that income is returned back. But the person does it, at the current price now is 20,000, because over the years, money had been devalued, things had gone. So the price that started 6,500 had evolved down to 20,000, but still far cheaper to what you would do it outside Nigeria, far cheaper.
Sure.
But the second question here is that all the parts of the country have had this in Enugu. And sometimes you see someone traveling from the north to come physically to do it in Enugu, and we start saying, no, you don't need to come. You could have gone to the office in Abuja. They will sample you, and then the Abuja will make sure your sample is in Enugu on time.
Okay. So now let's get to the meat of so the whole thing that is, where the lab is, everything there is online, is, real time. But there is one fundamental question. Now, do you do COVID tests? How is it? How involved are you with COVID testing at all?
Okay, so at the moment, we are not offering COVID testing at the moment, just now, though we have all the facilities, the testing kits, and all the necessary things to offer it. The reason being that when COVID came up, it became something, the testing was regulated. And then I don't want to go into subject of lab autonomy, but it became regulated because, of course, it was a national emergency. So I personally wrote to NCDC that we have this lab, we have this facility, we have this ability, and that we would like to offer that services wherever is needed for the COVID testing. The COVID testing, the COVID virus is what we call RNA virus, just like you have hepatitis C or HIV. Now, the core difference is that the COVID is droplet borne. So of course, you require a biosafety, which will have that level. Now, so in course of this application, NCDC didn't respond on time to enable us get what in quote is called being activated. So even though we are actively involved in research and have been testing at research level, we've been doing a lot of the COVID testing at research level, but we needed the NCDC to do the activation in order to offer it to clients at service level. But in the last 1 month, we were able to go back to them and they were able to retrieve the email. Of course, apologize that they couldn't follow it up at the heat of time. And they directed us on what to do to get activated. And what they've asked us to do to get activated are straightforward. One, to get the Ministry of Health Enugu to give us approval. And I'm glad to say that we've gotten that. We've gotten the Ministry of Health approval after 3 inspection visits involving all the inspectorates, the Commissioner of Health in Enugu. We've gotten that. The second is to have the Medical Lab Science Council to give their approval. And we've gotten the Medical Lab Science Council to visit, because they have to visit the facility in order to give the approval. But we've done all the documentations to them, which they are well satisfied and just needed to come for that visit. After this visit, we expect in the next 1 to 2 weeks that then NCDC will come for their own optimization and activation, which means check all the processes you have that which all these 2 bodies have approved, and then layer in their own quality assurance program into it. And then we are live in terms of providing this testing, for example, travelers and people wanting to know their COVID status. But we have been testing for COVID at a research level all this while because of that regulatory requirement that NCDs have to come to activate your center. And as I said, while our application got somehow lost in the system, but happy now that it's retrieved and the process is on and we're almost there. So to our audience, within the 2-3 weeks, we would have been activated and they would be able to access our services. I don't know, but those who know Enugu very well, we are in the heart of Enugu, Rangers Avenue. We are just 5 minutes away from Government House, 3 minutes away from Opera Square. So we're very accessible, 24 hours available space. We are just between Zodiac Hotel, which most people know, and Crunchies in Rangers Avenue. So we believe that once we're activated within these 1 to 2 weeks now, it will help a lot of travelers, people in the East there who will need these services at any time, not just say weekdays, weekends, they can just walk in. Along this discussion, I will show you the building, how the setting of that place, I will share on the screen. Okay. And it's easy to locate place in Enugu.
So now for clarification purposes here, what you basically said is, it means today, if you have samples, you test, you can basically test those samples and send them back. The only thing is that you have not been officially, that's where politics comes in. It's like, I know how to drive, I can drive, I've been driving, but until someone says, you can now drive by giving you a piece of paper. So now what you're waiting is that piece of paper, right?
Yes, you're right. But more to that is that we had applied to that piece of paper. Somehow the office misplaced it or didn't get to look at it quickly. But we are not worried because we know at the heat of those COVID moments, staff and so on will be very busy. So yes, you rightly described it well. We've been doing that. We have the facility to do it. We have all the things on ground. And now we are now at that step where they're about to say you are activated. So that activated means we can now assure the public that we've activated. You should go on and offer this service to the public.
Well, I think you might not want to say it because you're a doctor, but it is my duty and my job to say things that people shy away from saying. I would say there are some things that I believe the viewers would understand that as regards to the COVID, that, the files that you submitted many months ago somehow, got lost. But thank God, as you said, the files are back again after much pressure was put in for those files to come back. Now, The issue here is what it means is that if we, by the time the Enugu International Airport gets reopened, which we hope happens within the next 3 to 4 weeks before the Christmas time, I believe the timeline for you to get the certification is also within this period. Now, once that happens, now the viewers watching us now, what you're assuring them is that the moment they fly into Enugu, that those testings will be done in your lab, and those, like, how many days does it take to be done?
The test is given to you within 12 hours of you being sampled, if you are sampled before 4 p.m. So if you walk into Rangers Avenue and you walked in there before 4 p.m. of that day, within 12 hours, you will have your result. Now, if you come after that, it might then, it will now take up to 24 hours, but on no account will it go over 24 hours of you submitting a sample there and having your result.
Okay, so the way, okay, so that means we are getting somewhere that now, that will be done within Enugu. So for now, can you tell us, is there any place, any lab in the whole Southeast that does COVID testing?
Yes. So remember, when the NCDC activated what we call public laboratories, which is labs that are owned by government, which at that point, they were not meant to charge people for the testing. So as part of the response to the pandemic. So you had UNTH, which is the University of Nigeria Teaching Hospital, was activated, I think around May or thereabout, which meant that they will be able to provide COVID testing. That's in Enugu. I also think Nnamdi Azikiwe Teaching Hospital, which is in Nnewi, was activated. There's a private lab in Owerri that was also activated. So these three, and I think that there should be also a lab in Abakaliki that was activated. Now, the issue here is that the capacities of those labs, public labs and so on, are not much. It's very reduced capacity. One, due to the type of instruments being used. So if you really have a high volume of testing, they cannot cope. So not even high volume, medium volume. So what you talk about, if you challenge them with 300 and above samples per day, it will take longer days for you to have a result because of the capacity of the instruments to run those tests. But I'm on my own, I'm aware that the public laboratories like the UNTH was activated. And then I think the Nnamdi Azikiwe Teaching Hospital and a private lab in Owerri was also activated. And this was probably around May down to June, July, somewhere around that time. Now, okay. The other point to notice, having said the issue of capacity in terms of the instrument, is also you want to increase access to people in terms of when they want to run these tests. A lot of travelers don't have time. So they are traveling, they need result within 12 hours, within 24 hours. So they cannot wait a long time. And they want it also in affordable cost. So this is very, very important. One thing you realize is that with pandemic coming, travelers tend to be the people at the worst end in terms of being overcharged in many cases and having longer delays because of the capacity. So back to the issue of capacity. The machines that are used in COVID testing are called real-time PCR machines. So there are some that they can take only one sample at a time. So they put one sample and get the result at a time. So they are slower. And there are ones that can take 48 samples. There are ones that can take 96 samples. Now, in order to build a bigger capacity, so you need to be able to have a range of these machines to suit the way samples come into the lab. So if you're in a teaching hospital and you have the one that's taking one sample at a time, and you have 200 samples, you see that you will struggle to get the results because you spend like 30 minutes to test one person and get the result before you put another one. But if you're in a place and you have one that takes 96 samples, you see that you can have 96 people and their result will be released within 4 hours, following all the quality control and reporting, and of course the preparatory step in testing. So this is where the issue of capacity is actually affecting the service delivery in terms of how fast, how accessible, and how affordable is the testing to the patient. But let me also point out something that is very important. At the beginning, it does appear that there was a sense of restriction in testing. People weren't free to walk up to say, we want to have COVID testing. So that is what shouldn't have been in the first place. Both travelers and non-travelers should be able to have access where they are in doubt or they are suspecting or they think they might have had COVID to be able to go in and be tested. Because that way they can be quarantined if necessary. They can self-isolate. Yes, we are lucky in Nigeria. This hadn't been, yes, there are people dying, but it hadn't gone out of proportion. We seem to have miraculously coped with it. But there are more to coping with a disease, as those in molecular genetics understand, and even in medicine generally. So you need to be able to offer testing to people and make sure you have an idea an individual is infected or not. This is very, very important. Even though the society is re-engaged, people are moving freely, but you still need to know, and you still have to give the person access to be able to say, yeah, I have it or I don't have it. This is very, very important. Because somebody who has already underlying health problems and have the COVID could suddenly die, and that person would have died after having a drink with a neighbor. And then you could say, oh, the neighbor killed the person. So things like that, because people don't have the access. Thank you.
Okay. Can I, obviously some people watching now might want to know this. I mean, just for information purposes, if I may ask you, how much does it cost to do a COVID test? I mean, it's your business, but
yeah, in our own center, our price is 25,000 naira. But remember, we've not rolled it out as a service to individual. But this is our cost if you turn up to doing research in that area. So our testing price is 25,000 naira. So, and that's what we intend when we activated to maintain for the public.
Okay.
Yes, I'm aware that in places like in Lagos, people are charged like 50,000, 60,000. But our price, the safety molecular pathology price for COVID testing, which will be fixed at least for a year from.
Okay, and that's on individual level. That's not when you start working with NCDC, and the price might, it doesn't matter how much they charge the public, because obviously when people fly into Enugu, I mean, you are in the United Kingdom, we do know that in the UK it costs, I think £168, if I'm not mistaken,
yeah,
or thereabout. So that's close to 90,000. But you're saying that in Enugu, when you start testing, if I walk in because I think I've got malaria, it hasn't stopped for some days, and I'm suspecting it could be COVID, then if I walk into your office or into your center, say, I want, as a private citizen, to have this tested, you're going to charge me 25,000. Is that correct?
Correct.
Okay. So now can we come to the politics of COVID? I know you might want me to avoid it, but sorry, I wouldn't. The politics of COVID. Do you think in the Southeast that we are testing enough? Hold on, before you answer, just oppose this with this. We see NCDC roll out figures every single day, and we look at Southeast, it appears there is, as it appears on the surface that everything is normal. But I believe it's like an iceberg. When you look beneath, you might see some things that might be worrying. Now, this is your field. You tell me, do you think, from your experience, the politics of COVID, are we testing enough? Are the figures that we see correct?
Okay, so I think your question has two components. So let me start with one component, which are we testing enough? The answer is no, we are not testing enough. So we are far from what you call testing enough. So both at national and regional level, the capacities are low, in terms of answering that. So we are not testing enough, and we are not even near the enough. So that's one. In terms of figures, yes, to the extent they can collect data, the figures they have reflect to the extent. But because the healthcare system is not optimal, a lot of service deliveries may not be reporting centrally to them. And I want to point out something. Recently, we just concluded a study which was ethically approved. We got ethical clearance, where we studied blood donors to see how many of them had exposure to COVID. Either they currently have the infection or they've been exposed. We sampled two sites, Abuja and Enugu. Now, overall, about 43% of blood donors had been exposed to COVID. They've had it. And currently, of that number studied, 39% of them were currently infected. Now, remember, the blood donors represent a healthy part of our population, because that's why in the first place they could donate. These were predominantly middle-aged men, sampled Abuja and Enugu. Now, we sampled both because relatively the rate of infection in Enugu was slower and Abuja was higher. So wanted to see how the data will look at. And at the time we were sampling them, we were still climbing the curve of the pandemic in Nigeria. So which means, if you literally interpret that a larger number of people had been exposed to the COVID. So miraculously, yes, they were protected. We also know that part of that miracle we can explain. We have a younger population, and so long as there are no comorbidities, the death rate will be slower or will be lower. Yes, people died from COVID in Nigeria and may not have been captured in the NCDC data. And we know that reason because individual hospitals may not report to NCDC. And so someone may have tested positive for COVID, go to a hospital, been treated, died, and nobody bothers to report to NCDC. The other point to add is, so looking at the level of the infection in the society, as shown by this study, and possibly other studies others would have done, ours is now have been submitted for publication, which looked at this prevalence of the COVID infection. So 43% being exposed, 39 or currently had it, of blood donors. Yes, let me quickly point out that COVID is not a blood transmissible disease. So we're using the blood donors because they represent a healthy portion of our population. So we wanted to know. So yes, this large number have it. Yes, we may not have had, when you put the total deaths in this year and try to look at it with our average yearly annual deaths, so as to know what was the excess, which can then be attributed to COVID. So the year is still on, hasn't ended, because that's one way to statistically assess whether the COVID had caused an increase in deaths, since a lot of them wouldn't have been captured through the NCDC reporting. Now, the other thing to look at is, so is Southeast specifically disadvantaged than other regions in terms of access to COVID testing? Looking at what happens in other regions, apart from Lagos, where you have increase in access, but with a high cost of testing, in other words, people pay higher. I do not think that Southeast specifically is more disadvantaged than other regions of Nigeria. It is a fact that nationwide access and the testing capacity was very low. So if you put that together, you then find out that people struggle. Then also the attitude, we have this second study that we're about publishing, where we looked at people's attitude to the disease. And one of the simple questions we asked was, is COVID a scam? So you find out that about 29% of our respondents who are urban dwellers believe that COVID was a scam, that there's nothing like the COVID infection. Now, so there are a lot of things throwing up with that even if you have had the desire to test everybody, which of course the capacity won't be there, that not everybody would like to be tested in the first place. So we therefore look at, is their testing capacity enough for the vulnerable group, the elderly, those with underlying health problems, and then what we call the contingent group, like the travelers? So the answer to that is no, we don't have enough capacity. Okay. Then there is also another component to your question, because I have to look at the what I would call the medical aspect rather than the politics itself. So capacity to this vulnerable group and the contingent group, like the travelers, you don't have enough capacity, because you have to think this way. Imagine 1 million people turn up to a lab in Enugu in a day. Certainly they cannot cope up. They cannot cope with it. They cannot be able to test 1 million people. So then you ask the question, how many passengers will pass through Enugu airport per day? You know, so versus the capacity you have for that testing within that area, within Enugu. So if I have 1,000 passengers in Enugu airport now, who will need COVID testing, do we have within Enugu a capacity to sample these 1,000 people and have them receive their result within 24 hours since they are going to travel, and make sure that all those results are available and with the health authorities, so that if they need to verify, they can easily ring up the lab, give the test ID, and you said, yes, this was from us. So that capacity isn't there now. And so long as such capacities are not there, is affecting the overall performance of the system. Then bear in mind what I've said, the vulnerable, the elderly, those with underlying health problems, they should also be factored in the continuing testing process, because they are the people you want to protect. They are the people likely to die if they contract the COVID. So you need to factor them in existing testing capacity. The other question, as part of what you asked me, is the issue of access. Access means, can I find a place to do this test and go there and be able to be attended to, and of course, being affordable? So within just a matter of, minutes to an hour. So this is what somebody wants to do, whether a vulnerable person or a traveler. So we still have a lot. So the solution to that is, of course, what NCDC has rightly now started doing, which is activating private labs that have capacity, ability, the assurance to be able to carry out this test and make it that they are able to do it well. But this didn't come easily with them. It evolved. At the beginning, it wasn't involving like the Medical Laboratory Council coming to inspect you and so on, which is the right thing. You need the Medical Laboratory Council, being the regulator of labs, to be able to come in and inspect you and say, yes, you are within our capacity. Your staff are all competent. They're all licensed. Your infrastructure is okay. Your safety profile is okay. You have a way to handle waste that is very satisfactory. You protect the environment. We've seen the staff. We've seen the space you have. We've seen the facilities you have. They are calibrated. They are in good conditions. And we've seen your workflow. So that's what the Medical Lab Science Council does. And that's the right thing to do. But you then also look beyond the COVID. This is very, very important. So remember now the question is not just the politics, look beyond the COVID in terms of laying a platform, a sustainable platform that becomes what you can build on whenever there is an outbreak. Don't forget, at the moment, there is yellow fever outbreak just at a very low level. And don't forget, last 2 years or thereabout, we struggled with Ebola. And in some places, the Lassa fever outbreak. These are viruses that constantly threat people's health, public health. And there are over 16 viruses that constantly confront or threat health in Nigeria. So we need a sustainable platform that accommodates testing for them, and it's also there available for future. You talk about Zika virus, people have forgotten that. These are just within 2 years. These are viruses that have challenged the population. You know, Nigeria already has a high load of hepatitis C infected people. We have over 30 million Nigerians that are infected with hepatitis B. So we need a platform that is very robust, which means you have to activate and quality control a lot of good private labs with good capacity, testing capacity, good instrument, personnel, good waste management system, and make sure they are there and available, not just for now you're trying to handle COVID, but going forward to all other outbreaks. So that if somebody is suspecting, for example, Ebola case in Enugu, instead of you say, oh, where do I need to do this? You have the labs there to handle it immediately.
Okay. Okay, thank you very much. And now, let me have ask this clarification question. I mean, you said about 43% of those sample you collected. Can I know, are you able to tell us the sample size?
Yes. So we sampled 113 blood donors.
Okay, 113. So honestly, you know, it's slightly mind-boggling because that's close to 50%, 43%. And now what that means, anyone who is donating blood could be classified as middle class, could be classified as informed, could
Yes.
be classified as someone who is honestly because for you to donate blood, that means you understand certain things, that your blood is not going to be used for juju, or you've gone beyond certain level of reasoning in the society. That means there are those that actually could understand that the disease in question or the virus in question is real. Yet we have about 43% within that bracket. Now, what boggles the mind is those that are not informed. And those here, because when I read the comments, people even within the comment section are still saying that the disease is, or rather the virus is not real. And with that mindset, you touched on it before, that the mindset sometimes, kind of inhibits information flow. Now, those aside, the question to you is, what else could be responsible?
Just looking at all areas of social media with Nigerians, so as to be able to estimate, did we have more deaths this year than last year? Because that question is not yet addressed. But going back to what I want to say now, which is a little bit beyond the normal thinking, so that our people are also aware. Each time a virus challenges a human population, bear this in mind, even scientific community struggled for years until the French scientist was able to prove that human papillomavirus causes cervical cancer. And therefore, a vaccine against that virus prevented cervical cancer. One of the things we are not talking about is that when virus dwell with us, it tends to cause us something which our body will respond to accommodate. In other words, I'll give a good classical example, which I have had studies in. In the last 4 years, we studied a gene that is responsible for causing people, non-diabetic people, to have kidney failure among the Igbos. This study was done among the Igbos. It was a collaboration we had with a group in Israel, and we did a study with a group in UNTH. Professor Lassie was there, my lab. And we were looking at this gene called APO1 gene. This gene helped our people to survive the scourge of sleeping sickness. But now it's predisposing them to kidney failure. So we need to think a little about this. So now it's disposing them to kidney failure. You and I and everybody listening must have had a relation, a friend, a family friend, a colleague whose relation had gone for kidney transplant or dialysis or died of kidney problem. Is increasing. That's not questionable. And we found out that a certain percentage, significant percent of the risk type of this gene is prevalent in our people. So what am I trying to point out here?
But sorry, hold on. What led to that gene mutation?
Very good, because this is, of course, your genetic makeup must try to defend you against an invader. You must try to take a process to protect you. That's what the gene are there to do for you. And in course of protecting you, they will take blows. And those blows, if they occur and reoccur, they become mutation. They become a change in the DNA. And that change may then change the way that gene is functioning. So what I'm trying to drive home here is that many people didn't die of the virus has not proven of some consequences, latent consequences of the virus, which we are not asking now, but which may come out tomorrow. And that was the reason why we needed to continuously test and sample people so that we have evidence, we have the data. Now, if any disease, which might not be viral, starts occurring in the future, we may start looking at whether, did you have the virus so year? So as to be able to know, was this in any way linked? Because what do viruses do? They go in to try to redirect your kitchen. They go in to try to change the way things are in the kitchen where DNA is made. And that process could now lead to something that at the moment is not happening, but in future will happen. So you see that having access to the testing and actually testing your population is both a corrective and preventive effort you're making. It's not just because, oh, you have it now or you don't have it now. There's something beyond that. Oh, yes, they had it, they survived, but we are still keeping surveillance on them long after they survived the attack of that virus.
So this the point you raised now. I mean, it's a study you said you people have done with an Israeli company or something like that. Now, question is regarding probably eventual mutation of what we have today. Is there anything you think the government, maybe within Nigeria or within the Southeast, is anybody actually thinking ahead? Even private, or is anybody thinking ahead?
I do not think that they are taking ahead in this direction, because in first place, they struggled a lot to even come up to the point where there is even testing.
So basically we are being reactionary. We're just reacting to events.
Yes, and reacting slowly, not just reacting, but reacting slowly. Because I must also say something that will really grip you, something that will really shock you. Every teaching hospital in Nigeria has a real-time PCR machine. Just get this right. Now the question is, so when COVID came, why weren't they working? Why they weren't working is that typically the government buy these machines, put them in one room and lock them up. So in other words, when this threat came in, the raw capacity was there. They didn't need to buy those machines. Now, I'm telling you this from an expert point of view who had worked across institutions in Nigeria. I've trained a lot of people in molecular genetics across institutions in Nigeria. If you create a survey of institutions, teaching hospital in Nigeria, and ask, have you known Dr. Nna related to anything training? Majority will tell you yes. I have found out that the hospitals had the machine to do this testing. It is not only dedicated for COVID, you use it for other viruses. Now, I'm answering a question, why were we reactionary and slowly? That meant even though the machines were there, nobody saw what we saw 10 years ago. by setting up a molecular lab. When people were saying DNA what? If you talk of molecular, say molecular what? So why are we testing DNA? People they didn't think it would get to that point. As then we were shouting COVID, PCR machine, every hospital had real-time PCR machine, every government hospital. Quote me, I know this correctly, but they were not used. And why are they not used? Because we never thought, government establishment did not think that this will happen. Now, this is why this decision by NCDC to activate a lot of the private labs with capacity so that they have an active group. Now, it's not only testing for COVID, but they have an active group that will test, store these samples, keep these records. There is more. We need to know this virus that we survived, what is the nature of the types, the strain that infected our people. We need more study on that. Was it truly the less virulent strain?
Okay. You talked about the strength of the hospitals. Now, question is, do we really have, you talked about capacity. When you talk about capacity and you think, what you're saying is that the private hospitals or the private labs have more capacity than than the government ones.
Functional capacity. We have to differentiate this. The government hospitals have a physical capacity. In other words, they've gotten this instrument, they have the space. In many cases, they have manpower, but without the appropriate skill mix.
But how do they even store? Because your facility is run by 24/7 solar powered system. Whereas in government capacities, I think in government institutions, they do have generating sets and obviously the national grid. And we know how epileptic they could be. So how do you, if you're meant to store a DNA sample for 10, 15 years, does it mean we have the government hospitals or centers have these capacities where uninterruptedly power could be supplied for that number of years?
Yeah, thank you. That's why I was talking about functional capacity. They do not have the functional capacity because you have to store. Take, for example, in UK where you have Tissue Act, which tells you you must store a patient's tissue for this number of years. So there's reason for that. You can retest, you can research. The government institutions don't have that functional capacity. Remember, they have the physical capacity, but the functional. Now, you mentioned about solar. We have a 24-hour light system because we invested heavily on solar system. We drive energy from the sun with a very high capacity. Now, and we run an ultra minus 86 freezer system constantly on, storing, archiving samples in large quantity. Now, government institutions need to have this functional capacity. Yes, the infrastructural capacity may slightly be there, but they need a functional capacity because that's what it's all about. They had these machines, they were not using them. All of them, all the government, I'm telling you, had a real-time PCR of one kind or the other. Just somewhere locked down, they were not using them. It then was when the COVID came, they start thinking, how do we now do this? How do we do that? How do we do that? So why you need the private sector to be actively engaged are two reasons. One, the private sector takes a very definite decision to provide things like the light, the water, the environment, the storage capacity, and make sure they are constantly available. This is very important. The second thing is that now technology evolves. As technology evolves, the private sector is constantly evolving with technology. Now, I mentioned to you, for example, in our lab in Enugu, we have complete surveillance of the environment. So we can know who passed through this gate. Not just that we have that capacity, okay? But we check on it every time. So if I go to UNTH and say, for example, a teaching hospital, even though the capacity might be there, but making this to run on a regular, continuous basis is what will drive the country forward. So what we, not just because we are from private sector background, but what we are trying to point out here is that this current recent move by the NCDC to activate as many private labs with good capacity as possible is the decision, the right decision. Yes, it came late, but it's coming at a time when you need to prepare a lot of the private labs for any other emergencies that may occur in terms of outbreak, disease challenges, and you don't need to start thinking, oh, this is a national emergency, we don't know where to test them.
Wow.
The final thing to add to that is, so some of those machines the government institutions have, because they are not yearly calibrated, they are not yearly now followed up, they've become obsolete. So it's like having your car is parked one place, the oil is not changed, it's not moved, so the tire will go bad, the engine will, things will drop. Now you find out that those resources are just being wasted. And what do you do when you have outbreak? The government hospitals or labs then go back to say, buy this new machine for us. And this will be at the time when companies would have ramped the cost because there was a pandemic or there is a pandemic. So the cost will be high. Whereas they had this before, they would have been maintaining them and the capacity would have been there.
Okay, thank you very much. I mean, it's been an hour of information dissemination, and you basically unpacked so many within the last hour. So we'll be rounding up now, and it will be a good opportunity to invite participants. If you have clarification questions, you can raise your hand and basically ask your question if you so wish. And those of us watching online as well, if you have questions, you can type them in the comment sections. Your questions could be taken. Now, if you don't mind, can you utilize the opportunity exactly to share the facility? So can you now talk us through these, what you're sharing on your screen?
Okay, so this is the building of the Safety Molecular Laboratory in Enugu. So a duplex in Rangers Avenue, which has 8 functional laboratory units within it in the complex. So including where you do your routine testing and a lot of specialized testing. So it has the molecular testing unit, which we call the nucleic acid lab, the PCR lab. Then it has specialized unit for if you're doing like drug testing, people with autoimmune disease. That's diseases where your body starts producing proteins against itself. So it has a very big portfolio. There are people doing hormonal tests, cancer tests, people who are being monitored for cancer treatments. We still do a lot across the country, a lot of tests on people with leukemia, as I've said, who come here for the various tests we do for them. Now, so that is the physical building. Then I'll give you a little look into if I'm watching the inside, just a little of the inside. So
and this is,
you can see this.
For clarification, this is real time now.
Yes. So now I've taken a listing of the unit a little before we started.
Okay.
So this works on real time, So here you could see various units of the lab. You could see somebody at the middle in the lab there. You could see storage system. You can see down the corner there. That's our entrance. So this works on a real time. You could see people in various parts of the lab, what they are doing at specific hours in real time. This is streamed in real time. Now, don't forget as well that you can actually buy your test going to our website. So I'll share our website with us. I don't know if you can see that.
Yes, we can.
Good. So you can actually come in here and go to the test menu. and then select a test you want, see the dollar equivalent, and actually pay here where you are with your card, and receive that. That will be received. The sample will then come in.
So what you mean is, if, say, for instance, someone in the diaspora wants the parents or the siblings or whoever to have a test, what you're showing now bridges that gap of ripping people off, so they could basically go online, buy this test, and say, "Mama, now go and do this test. That's all. I have paid for it."
Correct. That's it. Perfect. So you go online, select the test, put her name. It links you to your pay. You make your payments. It accepts PayPal. You make your payment, and where you think you don't want to pay with PayPal, you make the transfer to them. That's that to the lab. The accounts are all there, but you're seeing the prices. So you can see, for example, here the test written BCR April. You can see that, which was a test I told you at the beginning. We still offer it $60, whereas here in the UK, you're doing that test for £180, for example. So you can come in here, select the test you want. Like we do a lot of people in diaspora who maybe have kids, they want to bring over, things like that. They want to do the paternity test. We sample them here, and our lab in Nigeria will also sample. We send the sample, they have the test for them. So they know the price, they can pay for it. You know, so you have the you have that. The other thing
sorry,
is,
when you said 25,000 naira, were you talking about the $60 equivalent?
no, the 20,000 naira.
Okay, that's okay. So if that was to be COVID, COVID will be more than $60.
Yes, COVID will be around. Yes, it will be more than that. Yes, because COVID is done at 25,000 naira.
Okay.
Which that would be about. Well, COVID should have been around $53, but we can check that. COVID
okay.
should be around $53. Yeah.
Okay, that's
yeah. But on this page, all the prices of the tests are all listed out. You can, and we update them as the prices come up. They are all updated in real time. You can just scroll down and check for the test you want.
Now, on the lower banner, right down, it says, "Can you chat? Let's chat." So if I go online,
a chat there, it will buzz me or buzz any of the staff that is working that day.
Is that 24 hours chat possible, or is that only working hours?
Yeah, at off period, it will send an email which will respond to you within an hour. So if it's like, if you buzz it now, it sends an email within 1 hour, because this is not this off call working hour of 8 a.m. to 5:30 p.m. Okay. So if you go during that hour, it will send email immediately. Within an hour, someone would have been contacting you or emailing you back on that this thing, on the whatever request you placed.
Okay.
Okay. So more to that also. In addition to seeing this price list online, so you see the prices and what you're paying for, more to that is that also you can see the sort of research we're doing. If you go up on that menu, you can see the type of research we do. You can look at, for example, individual publications. I don't know if you can see the page, for example.
Yes.
Good. So you can see the publication page. Now, this was a study I was describing to you, the high population frequency of APO1 risk variants with increased prevalence of non-diabetic chronic kidney disease in the Igbo people from southeastern Nigeria.
Wow, that was in the year 2013.
Well, very good. And we are still continuing study in that direction. So that's to give you an idea. And of course, I talked about the blood donors. We have been doing similar study. We did it for hepatitis B. You could see that. Mm-hmm. So from the website, you can see the range of researches going on in the center. And the other thing also to bear in mind is the institution has an approved government registered ethics committee, which you can see there, the Molecular Pathology Institute Health Research Committee, which independently looks and review every study that is going on, and they are monitored by the National Health Research Ethics Committee in Nigeria, fully registered, which Dr. Kanis Ayachukwu is their chairman. So you will also see beyond that what we call our research agenda. So going forward, what are the things we are doing? What are the things we're putting in place? What sort of technology? Like now we'll be working on what we call the transplant science to make transplant easy for people, in terms of their tissue typing. This is one area we are asking for our people in diaspora to support. When people have diseases that require transplant, they struggle to get a donor. The reason is that the donor is not HLA typed. So you don't know the tissue type that will suit you. So you see a family carrying 5 people to go to India in order to select one person that will be transplanted. Whereas we would have known who would be your donor. And only that donor will be prepared and will go to wherever you want to do transplant. So a lot of our people should support typing, HLA typing, which is then entered into a bone marrow registry. Well, another day we might talk about that, how a Nigerian in the US donated the bone marrow registry. And through the help of Professor Okoye, Ifeoma Okoye, who got through this guy, we were able to domicile it in UNTH in Southeast, despite every lobbying by other regions. And this guy who donated this bone marrow registry is a Yoruba person who was working in Goldman Sachs. This is where you register people, have their HLA type stored, so that when you need a donor, a lot of diseases are cured by transplant, so that they can donate. I know that this is not the topic of today, but it's important we let our people know about it. Currently, I've been handling a case of a Nigerian here whose daughter had a debilitating illness running in the family. One child had died already. The second received transplant a month ago. It took them, they kept searching for donor, could not see any donor. And they were given an unrelated donor, a white unrelated donor, despite all the appeal. They even had to go back to Nigeria. We had to type a lot of people for them. But before their result could come, the hospital had insisted on transplanting the child with unrelated white donor. So we really need our people, just like we donate blood, to think in this area. It has a lot of implications for our area. Now, so you could see what we are doing in those areas, the direction we are going, both for the testing and research. Now, the other thing I wanted to share quickly, because you asked, how do we then work together? So, so I'll quickly share this with you. Okay, I don't know if you can see my screen now.
Yes, we can.
Good. So when you get to work, or I get to work, or the person in Enugu or any of the branch gets to work, our web-based system is what I've logged in now, you can see. I don't know if you can see their safety molecular pathology. Can you see there?
Yes.
Good. So this is where you register somebody quickly. You go through all the departments. You can enter results here. You can see what test, who is doing what, and what time the person is doing it, what test is coming in. So here I can see what test. So without any confidentiality, you can see people whose results are waiting now to be authorized. So you can see where they are from, the area who referred them. Now, so you can see, you can work in real time with people elsewhere. That's within the branch, any of the branches in real time, because that's what they are, what software we are all using. You know, so you can see a wide range, like this result is authorized, who authorized it, you know, what time, and in real time, not just that you have that facility. So this links the whole lab process from receiving sample or taking the patient. Then one more thing to share with you. So once you come into the organization, the lab, one of the things you want to ensure is that your records are kept secure and that your records will be there anytime you want it for years and years. So I'll share this with you. The moment a patient walks in and it's for a test, the information you came with, which would have been your request form, will automatically immediately scan into our database, which is cloud protected in 2 different systems. So which means even if, say, you had a fire outbreak and computers were burnt in the lab, you hadn't lost any document. So I can come here, for example, look at this patient whose number is this. I'll briefly open to avoid confidentiality. I'll close them. So I will see that person who's referred the person, the client, the name, the number in real time, just as it's happening. And this information I kept for 10 years. So we store your sample for 2 years if they are like liquid sample. For tissue, we store it for 5 years. But your records, results, request forms, we store it for 10 years. So if you have done anything, come back 10 years, you have all that result. If you have had your sample to our lab and come back 2 years, if it was like a blood, and say, well, I needed the serum, you have it there for 2 years. If it's a tissue, or like we process it to DNA, you come back 5 years, you have it stored in the lab. So those are properly stored, and they are, under our quality system, highly secured. So you see that on a real-time basis, wherever you are, in fact, our structure, for example, you have the admin, you have the company's secretary based in Bini, you have the company's manager in another branch, you have the accountant in Enugu. So you can work with a group. You have people in staff working from Canada, who, because the system is linked. That's important. The system is linked on a real time. I can, so to show you another one, so you get, so if I want to know this patient that wants result to be released now, has the patient paid, for example? So this client has called that he wants result to be released, and I want to know, has he paid? I couldn't get to the accountant. I don't need to get to the accountant. So what I will show you now solves it. We use Sage, that is cloud-based. So I'll go to Sage. So this is company Sage.
Yeah.
So I'm on Sage now. So I can go to that customer, open the customer, open the dashboard. From there, I will process and be able to know who is that customer, So you see that way you can check what you want in real time. Good. So you could be able to release that customer's result, whatever is needed, without wasting much time. So now I've shown you a lot of things web-based, the LIMS web-based, the accounting system web-based, the website so that you can go pay in things, the scanning system for the records, the CCTV, you can monitor things around and see who is doing what in real time. And of course, the company's training system on Zoom is very superb. So you always have people on Zoom. You have team viewer, linking of things with any desk. So a lot of technologies have gone into this, which is what it should be.
Wow. So without the internet, now your operations will be grounded. Basically, that's what.
Yes. The internet is the LCM, and that's why we are at the forefront of always looking for the best internet technology, and we deploy them very quickly as they come in. The internet plays a key role. We are constantly on the internet around the lab, all the branches. And we are grateful that the internet has really improved in Nigeria over time.
Yes, thank you very much for your thank you very much for all you have shown us. I mean, it is unbelievable what you guys are doing, and it is mind-boggling. I'm happy I was able to, reach out to you, and I must thank once more Sir Engineer Chris Okoye for making this possible. I can see he was in this meeting before. I don't know if okay, he's still here. I do not know.
Let me also chip in. Sir Chris Oke is the chairman of Safety Molecular Pathology. So so that you understand as well. And
okay, so he's also involved. I mean, he has been one man that I know that is so passionate about the Southeast, and has done a lot in terms of articulating the developmental agenda for the Southeast. In terms of articulation, when people say, is there any blueprint for the Southeast or the Igbo nation? And I laugh because maybe they have not read one of the best blueprint that has ever been developed. And I must say thank you to him once more. And to you as well, thank you for, in the last hour and plus, we've been having this conversation. Then it's time once more to say, if anyone has any question, you can use the Zoom facility to raise your hand. And I think I've seen a question here on the screen from those watching online. One of the questions is, how long does it take to get the COVID test? I think the person asking that question, you mentioned that it could be done in 12 hours or maximum 24 hours. So I think maybe that individual joined us very late.
If you get to the facility before 4 p.m., within 12 hours, the result will be ready. In fact, some people go there and stay there till the test is done. So they walk into the lab and their sample is collected and they stay there. They can wait. We're very close to a lot of eateries, crunches close to us, a lot of eateries around where we are. So they hang around within the time period. But if you go after 4 p.m., because after 4 p.m., we reduce number of what staff are doing. In other words, staff start looking at other things.
I'll call them back.
Okay. Sorry, I think.
All right. Can we win another?
No, sorry about that. One more question here. John Okolie says, what about your privacy policy since there are no laws for such in Nigeria? How safe are the data?
Our data are highly, highly secure. Now, so all the data things we use, like the cloud computing, are highly secure. And then if at any time, any computer, so one of the things I haven't shown you is how the computers are secured, okay? So I know in real time when a computer is threatened. So from here, because of the, we subscribe to a very important device for doing that. So, which for want of time, if not, I would have shown you where on real time, we monitor every computer. And the idea is that if any computer, any point is threatened, and also computers are level passworded. So if I go to, say, a chemistry lab, you only access what you need in chemistry. Like there's a unit we call the CIA lab, okay, because they do clinical immunoassays. So if I'm in the CIA labs where they do a lot of the hormones, okay, now you only see things related to the hormones. Okay, so you don't have access to, you can't stay there and read a patient result, but you can input your detail. Now, of course, our main controlling computer system is here in the UK, where everything feeding on real time. Now, so this is computer cloud storing. Now, in terms of how your results is released to you. So let's say you did a test, for example, you paid for your parents. Now we give result to whoever paid for it. So if you say John paid for test for Mary, and Mary came to the lab, so we ask a question, John, do you want Mary also to have a copy of this result? You say yes.
Are the results sent by email? Can you just email the results?
Yes, we can email results to you. If you're a private person, yes, we email result to you.
Okay, because I know in the UK, when they do a COVID test, the ones that go to the private doctors to do the COVID test, and once that is done, they get their result by email.
Yes, we email results, but if you're like a lab, because we do testing for a lot of labs. So
Okay.
in fact, we are known as a lab for labs. So,
Okay.
so those labs will give them a portal. They log into that portal and see
Okay.
the results.
Yeah.
Yeah.
Now, the final question here is for clarifications. Someone here has been saying that other nations, people, or the countries do COVID tests for free. Are you aware that Nigeria charges money for COVID tests except the ones done for travelers? Because the ones done for travelers are the same everywhere. As long as you're traveling, it's your choice. The government have advised you not to, but if you choose to, you pay for it. So are you aware if, aside the ones for travelers, if Nigeria charges money for COVID?
Well, at the beginning, the ones for part that was part of monitoring, trace and test and trace were done free by the NCDC. But that means you have to go through that step. That is, there are symptoms, you are then referred to an NCDC personnel who then authorizes your testing in a public lab. So those were done.
And those ones are free.
Yeah,
now,
test and trace.
Okay, so now we'll be rounding up now. I have the last question here from Professor D. He says, where is your office in the Southeast? I believe you joined late, but you have the privilege to now give.
We are in 44. We are in 44 Rangers Avenue, Independence Layout, Enugu. We're just between Zodiac Hotel and Crunches. So we are in 44 Rangers Avenue, Independence Layout, Enugu. But just for other benefit, because some of your audience in Southeast might be joining elsewhere. In Umuahia, we are in 28 Aba Road, Umuahia. In Owerri, we are in kilometer 5, Abala, in Owerri. In Onitsha, we're in Lenka Road, near St. Charles, Boromi. We're number 16 El Lenka Road in Onitsha. In Bini, we're 195 Obowo Road, Bini.
You have all your offices. You can just say them by heart.
Yes, I know them. I visit them always. Then in Lagos, we're in 11 Ogundana Street, Allen Avenue. In Lagos, 11 Ogundana Street, Allen Avenue. In Abuja, we're in Lozumba, 217 B Lozumba, the Gariki 10. Now, so these places you can walk in anytime. They are the same place. They are all linked. Now, our testing hub is Enugu. The Enugu lab is the testing hub, and you can always get them at any time.
So can you state your website again? I believe the website
is www.themping.org.
Okay.
THE, that's the Molecular Pathology Institute, Nigeria. www.themping.org. Now, anytime you're in doubt, you can email me e.nna@themping.org. You can also email the admin at temping.org. Well, that is the website, which I showed you before. So importantly, the website, you can actually go there, book your test, pay for it there, and then turn up or ask. We also, another important thing is we layered into our services a very perfect courier system. So you don't pay to send us sample. So we pay for that. So let's say you're sending sample.
So when you do that, it's within the $60 you've paid, right?
Yes, exactly.
Everything inclusive.
With it, very good. So let's say you are in New and you are sending sample. We'll tell you, okay, look at the transporter we use. Give them, we handle that. It comes to us, we collect that. It's within that $60 you've seen. That amount, you are not charged extra.
Okay, so to clarify this, so meaning whenever you start, let's say whenever you start the COVID tests, are you going to do the DIY testing where, well, I am in my house in Anambra State, and I can get your sample kit and basically wank my nose and my throat and send it off to you without coming down to Enugu?
For the COVID, it's not advisable to do that because the collection of the sample plays a greater role in the quality of the testing. So it's not the type of testing you can, like if it's paternity, you can do that.
Yeah, but in the so hold on. But in the UK where you are, people are allowed to do a DIY test.
Yes, remember in this test for the real-time PCR, you are using the swab. We want you to be swabbed. That would be much better. Not like a saliva test. What we do is the definitive diagnostic test. Remember here, there are 3 different kinds of tests. You can do a saliva test, but what we do is the real-time PCR test requires us to sample you properly. At the moment, we don't think that it's good for you to sample yourself for the real-time PCR using the swab, which is
okay.
So we prefer a health person. And also, even though we can sample you in other facilities, we want you to be sampled because in Enugu, there is a special room dedicated for the sampling where the airflow and extractor fans are controlled. So when you walk in, the extractor is taken off your breathing and the airflow is meant in such a way that the person sampling you and you are all safe. This is very important. So we have to give this level of biosafety to make sure staff is not infected, and you also, the person coming, if you weren't infected, that we don't infect you in our facility.
Okay. So do you have any plans of, eventually when the airport opens, do you have any plans of testing at the airport?
Yes, we believe that once we're activated, the next step is to get into discussion with the airport authorities to be able to have a facility in the airport so that people can actually turn up there and on what we call emergency mode, and they'll be tested in the airport. Yeah, we have that. But the large bulk of, interestingly, we are just 10 minutes away from the airport if you drive in Enugu. So if you're in Enugu airport, drive out, enter Independence Route. There we are, past Toscana, Government House, turn left, that is Safety Molecular.
Okay, so the final question here from, I think, Ugochukwu, it says, do you share the same view that COVID-19 virus gets fast dehydrated within 7 hours under high heat?
Well, what we know is when the virus is on surfaces, it's been studied on different surfaces, and it can stay in some solid surfaces 2 hours, 4 hours, that's the droplets. So there is no concrete evidence, meta-analytic evidence to show that heat actually impacts the virus different. And that is in terms of scientific evidence. Remember, viruses are very small particles. So they've been found to stay on surfaces, papers, metal surfaces, ions for some report up to 6 hours. So we don't think that heat in terms of weather has been a factor anywhere, because you could see cases in US, even in cases in Latin America.
Yeah. The places that are so hot. Anyway.
Yes, exactly. So we don't think that heat has been, but if you go to the nature of viruses, they are very small particles that when they are outside the body, they are still there. When they get into the body, they start redirecting things. So but what study has shown concretely is that these droplet-borne particles can stay on. For example, if somebody is infected, sneezes on a naira note, it could stay up to some hours on it. So if you then handles that close to your own nostrils and so on, you could be infected. So what we do know is that the heat has not been proven scientifically with evidence that it is a factor in reducing the spread of the virus. So but having said that, I want you to go with this message that our young population might be what has saved us, rather than, because our aged people live in the rural areas mostly. When people are
already isolated anyway.
Areas, so which are not dense, whereas the younger people are there in the cities, and they could have had it from what I've shown you in our study, and they overcame it and continued without knowing they had it.
Well, Dr. Emmanuel Nna, that says this MD CEO Safety Molecular Pathology Laboratory in Enugu, Nigeria, Southeast, to be precise. It has been a wonderful time that we have spent with you. We have, people that have followed us online and people that have joined us in the Zoom. And the things you do, we can only say thank you. And we say, more grace to your elbow. It gladdens the heart that some of these tests that you talked about, all over Nigeria, the only place that could be done is in our own Southeast. We knew a time where anything that you have to do, you hear, oh, go to Kano, go to Lagos, go to, equally, our place is now a place that you can say, oh, go to Enugu, and you have something that could be likened, that could be, what happens anywhere in the world happens here in Enugu. It gladdens the mind. On that note, I will say once more, thank you very much for joining us and for your time. It's been a wonderful time we have spent with you. I'll allow you to have your parting word for all the viewers that we have across the globe.
Yeah, to everyone who have listened, thank you for spending the evening. Coincidentally, today is my birthday, and so once I finish, I will be going to enjoy my wife's delicious food for the birthday. Please stay safe, still protect yourself, still wear the face mask. You do not know what the virus implies over the years. Still wear the face mask, do all the hand washing, and then still keep that distance with people, even though it appears more, it's like people are not dying as it would appear. Also, if you feel something that has not been stopping, you think it's malaria, hasn't gone, and it has stayed long, you can go for testing, have yourself tested. And in Igbo, I would say, Chuku gozi onye ọbụla, and chebe onye ọbụla ebe ọbụla anyị nọ, and ihe anyị na-eme ka ọ gazie ọfụma. Thank you.
So on that note, and that's a fine place to leave it, I'll say thank you very much for your wonderful time. And everyone, every viewer out there, we say thank you once more for being our guest, and thank you for watching. Thank you once more. Enjoy your evening. Once more, I am Mazi is okay.